Hey everybody, it's me again, trying to give you some good content for you guys, runners and anybody else who wants to hop on and kind of help themselves figure out maybe what's going on. If they have some medial knee pain, or what we call pain on the inside of your knee, not deep inside, but on the inside of the knee. So, I talked about the saphenous nerve yesterday. They can mask if you look up saphenous nerve, spelled S-A-P-H-E-N-O-U-S. You look that nerve up. If you just follow what it does, it can mask as a lot of different structures in the knee, on the inside, the front, not the back or the outside, but on the inside and the front. Hey, Shauna. Anyways, let's talk about the MCL a little bit today. Maybe you have the knee pain and on the inside, and maybe you don't, but something that I've noticed to kind of help maybe self-diagnose or self-assess. Maybe it's not a diagnosis, but help you self-assess maybe what's going on. The MCL is connects from your tibia to your femur, and it's a kind of a thin band. It blends with the joint capsule, all that other stuff with anatomy. But anyway, it's pretty point tender when you have it, and there's a lot of special tests, to figure it out that you learn in PT school and some other stuff. But I gotta tell you, one of the easiest things to let me know whether or not your MCL is irritated is simply by, let me show you. It's not hard. All you got to do is just turn your foot out, and the ligament pops out right there. You'll feel it kind of get a little bit more taut. The more you kind of turn your foot out, it'll get taut right there. And if you have some knee pain right in here, and you turn your foot out, right? If you turn your foot out right on the inside of your knee, you might have some pain right there. So the MCL really gets stressed. It limits this. And so if you turn your foot out, it'll pop right into your finger just a little bit. And if it's painful, it's probably your MCL. Maybe, meniscus, and we'll talk about that tomorrow. But maybe it's your MCL. And yesterday I talked about the saphenous nerve, and the saphenous nerve goes all over the place, and so maybe it's saphenous nerve as well. But if it's super point tender right there, and it's painful right there when you turn your foot out, the MCL is getting stressed. And so it's kind of an easy way to kind of self-assess a little bit and get you ahead of maybe what might be going on until you see your doc or PT or whatever. And it might not feel like it's that big of a deal, but let's see here. The things that tend to make it a little bit more painful there is, and it may not feel like it's that big of a deal, but if you have a foot that kind of collapses a little bit, mine does if I didn't have the right shoe. If you have a foot that kind of collapses, and or you have kind of a weak hip that can't kind of keep your knee lined up. The thing is, your knee likes to kind of bend and straighten. It gets caught between a foot that sometimes is fairly mobile or not mobile at all, or in the middle, and a hip that's a ball and socket joint that can move all over the place, and so it needs to be pretty solid if it's going to kind of direct what your knee does. Your knee just kind of gets caught in the middle between the two and just wants to bend and straighten. But if it's allowed or directed by your foot or your hip, then that kind of stuff is going to happen. So if your foot is a little bit more mobile, you can see what's going on is that when your foot maybe collapses a little bit, you see what happens to your knee. It does that, and that's exactly what the special test, or that test is that I just did when I turned my foot this way. Although not as excessive, this is excessive. When your foot's on the ground, it's not as excessive, and even just a little bit in, but cycle after cycle, and in tens of thousands of them, when we're running or walking or doing whatever on our feet, slowly you may be starting to have a little bit of pain on the inside, right on that MCL. And the way you kind of test it out, or one of the easier ways is what I just did. Just turn your foot out, pain right there. You know, it'll be painful generally, or right there. Even without touching it, if it's actually painful, you can just go there with your foot, turn it out real good, and it should be painful without even touching it if it's MCL. But if you have any question and you press on it, really super point tender, MCL pain, ouch. And so that's when you start thinking about really strengthening your hip, your glutes, your external rotators, and your extenders of your hip. Your big house, it's also called. Strengthen that up, and also find the right shoe for you. You know, sometimes the easiest thing to do is to get a stability shoe, and go from there. Maybe what I've noticed is that sometimes people end up being in a little bit more of a neutral shoe, and to me, a neutral shoe essentially is nothing for a foot that just isn't very, if it's not very helpful, then if your foot's not very helpful, and it's kind of flattening out a little bit, the neutral shoe is essentially nothing, and it's really just for a foot that needs a ton of just shock absorption, because it won't absorb any shock. And that's for the foot that tends to be relatively high and not absorb shock at all. So it doesn't really need support, meaning nothing. It just needs a little bit of just cushioning, because it doesn't do a very good job at absorbing shock. It needs something between the two. But anyways, I hope this helps. You guys kind of discover maybe possibly what might be going on with the inside of your knee. Tomorrow I'll do the medial meniscus a little bit more, and we'll talk about maybe medial plica. I don't know if you guys have heard of that. Anything else that you guys want me to talk about regarding the inside of the knee, let me know. But I plan on doing a series on the medial side of the knee, the front of the knee, the outside of the knee, the back of the knee, and then maybe we'll work our way down into the lower leg and then the foot and ankle. I see some people on here. Shauna, thanks again, and Luther and Kimberly, thanks so much for watching, guys. Trying to just give you guys some content, help you guys out while your PT clinic might be closed, or if you just need to kind of help what's going on. Sometimes the physicians aren't very helpful. They tend to do the pain pills, injections, and surgery stuff, and that's kind of their wheelhouse, and that's mostly what they know. They don't understand the lower quarter mechanics that well. But I'm trying to help you guys out in that. So if that makes sense, go ahead and put down makes sense or helpful, or if you guys have any questions, I'll hang out here for a minute or so here. If you guys got any questions, I'll be happy to answer them. Whatever. My wheelhouse is running and runners. So whatever you guys got a question about, I'll just kind of hang out here for a little bit. But yeah, I'm you guys that are on right now, if you guys might know anybody that is, specialist in endurance nutrition experts, I am really wanting to figure out how to, get them, just interview them on Facebook and just give some valuable content to you guys out there. Hey Ingrid, I'd love to do that and just give you guys some more stuff that'll help you guys out. But yeah, if you guys got any questions, give me a holler. I'll hang out for a little bit more. Let's see what else. Yeah. The saphenous nerve, I can't stress it enough. The saphenous nerve, if you look that nerve up, saphenous, it masks as a lot of different types of knee pain. And sometimes people don't know what's going on, particularly the people that are treating you, and they don't consider the nerves being pain generators a lot. And obviously sometimes it can be a ligament, obviously it can be a tendon. Oh yeah, dude, glad to be helpful, Luther. Please instant message me and we'll chat. Be happy to do that. And I don't think you owe me anything, bro. But we'll chat. That'd be fun. So I've said it before and I'll say it again. If I had all the money in the world, I'd treat runners for nothing. They're just the people that enjoy running. They tend to be pretty motivated and want to they understand that health and wellness is important. Sometimes they're trying to hit that next PR, and I'm just excited to be able to get them back on the road and hit their next PR. So anyways, any questions, you guys can instant message me if you like to. I'll be happy to chat with you. Jen, hey, thanks for hopping on. Trying to get anybody out there to ask me any questions about foot and knee pain or whatever. If you guys have any questions about anything, I've been trying to get, a buddy of mine has been trying to get me to finish my book up, and I've been trying to finish my book up. I think I just need to get it out. Hey Katrina, I think I just need to finish it up and get it out, but because it's what I've been doing for almost 15-20 years now, regarding the foot and ankle, lower leg, knee, and all that jazz. So anyways, if you guys don't have any questions, I'm gonna hop off here and maybe do the medial meniscus tomorrow, and just give you guys some food for thought, if just understand pain points a little bit better, what may be limiting you in your running, and maybe some tips on how to maybe get ahead of it. Hey Jonathan, but yeah, so anyways, give me a holler, let me know if this helped or didn't, and if you want me to concentrate on something else. But yeah, love you guys, have a great night, be safe, and we'll talk again tomorrow. Probably around the same time. Take care, God bless you guys.